Hello everyone, and welcome. Today, we're diving into a common and often alarming-looking eye condition, conjunctival hemorrhage, also known as subconjunctival hemorrhage. While it might seem scary to see a bright red patch in your eye, it's usually harmless. Let's explore what causes it, how it happens, and what you can do about it. So, what causes this bright red spot? Conjunctival hemorrhage occurs when a small blood vessel breaks under the conjunctiva, the clear membrane covering the white part of your eye. The most frequent cause is simple trauma. Rubbing the eyes too hard or even a strong sneeze or cough can do it. Other potential culprits include high blood pressure, certain medications like blood thinners, bleeding disorders, eye infections, heavy lifting, and even wearing contact lenses. Now let's understand the how behind it. The conjunctiva is thin and contains many small, fragile blood vessels. When one of these vessels ruptures, blood leaks out. Because the conjunctiva is transparent, the blood is readily visible as a bright red patch. The blood gets trapped because the conjunctiva is also tightly attached to the underlying sclera, the white of the eye. This prevents the blood from spreading out, creating that distinct, localized redness. Conjunctival hemorrhage is quite common, affecting people of all ages and races. It doesn't discriminate. Factors like age, underlying health conditions such as hypertension, and the use of blood-thinning medications can increase the risk. However, the majority of cases occur spontaneously, without a readily identifiable cause. The most obvious symptom is a bright red patch on the white part of the eye. Typically, there's no pain, vision change, or discharge associated with it. Some people might experience a mild feeling of fullness or scratchiness on the eye's surface, but this is generally minimal. The size of the red area can vary, ranging from a small dot to covering the entire white part of the eye. Diagnosing a conjunctival hemorrhage is usually straightforward. A doctor can typically diagnose it simply by looking at the eye. They may ask about your medical history, including any recent injuries, medications you're taking, and any underlying health conditions. In rare cases, if the hemorrhage is recurrent or associated with other symptoms, further investigations like blood tests may be needed to rule out other underlying medical conditions. Generally speaking, conjunctival hemorrhages are not classified into different types. The severity can vary based on the size of the hemorrhage and the underlying cause, but the core condition remains the same: a broken blood vessel under the conjunctiva. Thankfully, treatment for conjunctival hemorrhage is usually not necessary. It typically resolves on its own within 1 to 3 weeks as the blood gets reabsorbed. Artificial tears can be used to relieve any mild irritation or scratchiness. If the hemorrhage is associated with an underlying condition, like high blood pressure, managing that condition is important. In very rare cases, if there's excessive discomfort or concern, a doctor may recommend further evaluation. While you can't completely prevent conjunctival hemorrhage, you can minimize your risk. Avoid rubbing your eyes vigorously. If you have high blood pressure, manage it effectively with medication and lifestyle changes. Use eye protection when participating in activities that could cause eye injury. If you're on blood thinners, discuss with your doctor whether the dosage is appropriate. The prognosis for conjunctival hemorrhage is excellent. It almost always resolves completely without any long-term effects on vision or eye health. There has been ongoing research into better understanding the relationship between spontaneous conjunctival hemorrhages and underlying cardiovascular risk factors. Some studies suggest a possible, though not definitive, association between recurrent or unexplained hemorrhages and an increased risk of cardiovascular events, highlighting the importance of regular health checkups.